She's just concerned about herself. But that is not true. If we are taking self-care, we are talking about our health, we are wellness freaks, we are doing good to our community. Because if you're healthy, you're happy, you contribute better as a mother, as a wife, as a worker in your society. So in all segments, a woman health is a very, very important element. And Women's Day are just few days where we are giving reminders to the women that see, you are responsible for a lot of things, you're important, and you yourself are not giving yourself that importance, and you just want to wake people up that this is important to be considerate about your own well-being. So that is the reason, we observe these days. And Women's Day this year, although it talks about investing in women, it's talking of financial security. But financial security does not help you unless your body is cooperating with you in terms of enjoying those financial liberties, or being entrepreneurs can only be successful if you are healthy as well, because then only you can contribute to your workplace. So talking a bit about the Women's Day, because I thought it's a Women's Day, so I wanted to share my viewpoint on it. I would now apprise you a bit about what you should be knowing about breast cancer, because it is one of those diseases which is very common in our country. Most of you would be knowing a lot of things. I would not be talking something which you don't know, but you need to be reminded. Even, even the learned, even the doctors community, sometimes we need to remind people that these are the things which you should be doing in a consistent fashion every year to ensure that you're not harboring such diseases. So what should we know about breast cancer per se? I will just prime you firstly about a little bit about cancers, and then talk more focused on the breast cancer. So we should be talking about cancer because we see that cancer is touching almost everyone. So if I talk biologically, in everybody's body, every day, there are cells which are dividing. When these cells are dividing, sometimes the DNA of the cell does not have the right encryption, and the cell, because of some mutation, may not divide in the way it should be. Normally, a cell divides in a particular fashion, which is programmed. But when cell does not divide in a particular fashion and cancer cells build up, your own body fights it. So if the cells are few in number, your own white blood cells, your own police checkmen in your body, they identify and destroy it. Whereas few people, unfortunately, who do not have a good immunity, or the number of cells which are being formed cancerous are going beyond the threshold which the body can take care, will develop frank cancer. So that is why I said everyone is touched by cancer, because these cells keep on building, developing in practically everyone's body. Secondly, why I say everyone is touched by cancer, because the incidence is so high that you might be having some friend, relative, close loved one who might have faced this disease or is struggling to get treated through this disease. So that is why it may touch, anyone. Secondly, why you should know about it, because it has become one of the leading causes of death. In our country, if I talk just of India, there are three reasons by which people lose their life. Cardiac diseases, that is the heart problems, accidents, roadside accidents is a big problem, and third is cancer. So it is one of the killers. And unfortunately, despite the fact that it is a killer, people don't know that it is something which is preventable. In as many as 40 to 50% cancers, we know what is the cause, we can correct it, we can avoid getting those cancers. That is why it is important to understand what can be done, or what reforms you can bring in your life to prevent such diseases to happen. The fourth reason why we should know about it is because you would be aware that there are tests for many cancers where these cancers can be picked up so early that they can be treated with minimal treatment, or in some cancers even it can be picked in a precancerous condition where the treatment is just so small that it can be performed on an OPD basis. So that would save a lot of financial, physical, as well as emotional trauma if the disease is tackled right before it has even become a full-fledged cancer. So that is why we should talk about it. And as you see in this second snippet which I've shared here, we also should be talking about it because in our country, we are having the highest rates of certain cancers like cervical cancer, gallbladder cancer, oral cancers, as well as pharyngeal cancers. And most of the cancers which come to the hospital are in advanced condition. 70 to 80% patients come in a very late stage. They are more so elderly in West, but in our country they are young. And they come at a time when it is too late to actually do much or contribute in terms of causing cure. And unfortunately, very, very high numbers are seen in the minors, that is the young population. That these are the alarming facts. That is why we conduct programs like this to sensitize. So who can get cancer? So if you look at the age parameters, if I will talk of breast cancer, surely it is women above 50 years of age who are at high risk. But cancers do not discriminate. I have seen girls as young as 18 years also develop breast cancer. So cancer is very secular. It can affect any age group, any gender. Breast cancer happens to men as well. And it does not also discriminate between the strata. It is happening in all strata, all segments of our community. And reason why it is increasing, firstly, particularly so important for breast cancer because we are getting more and more westernized. Our way of eating, our lifestyles are becoming so much westernized that whatever diseases were existing in the Western world are slowly and slowly creeping into our community. So what we mean by urbanization? Is it living in pakka houses, eating on, not the chulas and the gases? That is not urbanization. So urbanization practically is talking of the fact that our physical activity is decreasing, our age of marriage are increasing, first childbirth is getting late, and so is the high incidence of no children there. Nulliparity is also increasing. So these are the urbanization, the professional career orientation which we want women to get done are simultaneously also affecting their childbearing, and all these combined do somewhere are causative effects. When you will understand the breast cancer, you will understand why I'm stating that, are all contributing towards higher incidence of these cancers. And as I mentioned, that snippet I did show you that in India, the cancer is happening more in the younger population, especially people who are younger than 70 years. I will just share an amazing fact, which was shared in one of our leading newspapers also. It was a study conducted by a very reputed journal. It was published in Lancet, and they said 63% of cancers in the Indian subcontinent are preventable, which is such a huge number. 63% is a very, very, immense figure. If we really work on it, that means if 100 women were to get cancer, we can prevent 63 women from getting those cancers. So that is why it is important to understand the risk factors. So this is the figure we have in today's time. 2023 data hasn't still built up. We still are having the data for the last 2 years. Globocan is soon going to publish the recent data. So in the last year, overall, the number of cancers which happened, the new patients which came up with cancer were almost 14.5 lakhs. Of this, almost quarter to 3 lakh were related to consumption of tobacco. And more than 2 lakh women in our country developed breast cancer in the last year, which is almost 40% more than what was happening somewhere in 2018 or 2019. The numbers were much lower. Fortunately, the dip which is happening is in cervical cancer. Cervical cancer somehow have become number 2 cancers, and number 1 cancer in our women is now breast cancer. So this is the epidemiological status of how cancer numbers are playing in our country. Though I would not, leave you with a very, very dark message that everything is going wrong. Though the numbers are increasing, good news is that the technology, the treatment armamentarium is also improving. So survival rates are improving in few segment of patients where we are getting more targeted treatments. But major impact which is happening is because of programs like this, where people are becoming better aware and are going for screenings to get early detections. So coming back to the basic biology of cancer. So I think most of you in your school time in biology must have read about cell division. So normally when there is a cell in a body which is to divide, it will divide into two, and the process is called mitosis. But in the cancer cells, the cell does not have the programming. It does not have the programmed cell death signals. So the cell divides uncontrollably. So instead of dividing from 1 to 2, it divides into innumerous numbers, just like the chain reaction of a nuclear reactor. And these cells which are formed, they are useless cells. These cells are of no function in the body, rather we call them parasites. So what they do is they go and go into the blood supply. They can travel to any part of the body. They can even erode the vessels. When they press areas around them like nerves, they may cause pain. When they erode the blood vessels, the blood-bearing vessels, they can cause bleeding. They can cause swellings. They can cause what in commonly people say guilty, gant, sujan. So these are the symptoms which people would feel when these cancer cells are growing and dividing uncontrollably. And as they keep on growing, depending upon which organ they go and travel and where they start to grow more and more symptoms would come. So what is the basic cause? Why this cell, which was supposed to divide into two, is not dividing into two and growing uncontrollably? Because it is getting some signals which are causing it to mutate. So why mutations can happen? Either there is incidence of consumption of alcohol and tobacco, because tobacco is responsible for 1/3 of the cancers which happen in our country. Tobacco contains at least seven, the smoke of the cigarettes contains at least 7 class 1 carcinogens, which can cause cancer of the breast. It can cause cancer of the throat, lung, intestine, urinary bladder. Practically every organ in the body can get cancer because of smoking. And breast cancer, as I tell you, it is not untouched by the bad effects of smoking as well as alcohol. Few cancers can happen because of uncontrolled infections like human papilloma virus, HIV, hepatitis. A big segment of cancers, again, it is important in terms of breast cancer causation, is because of unbalanced diet. So by unbalanced diet, we mean people who are eating foods which are very, very high in glycemic index. That is more of a processed sugars, or they are having a lot of calorie intake leading to obesity, pet ka motapa. The truncal obesity, if it is happening, then it is predisposing to cancers like breast cancer, endometrial cancer, and in men, it can cause the prostate cancer and colon cancer in both the genders. So unbalanced diet with less fiber, more carbohydrates, more so processed carbohydrates and sugars and fatty food are responsible for 30 to 35% of cancers. The third important fact, particularly for breast cancer, is the hormones. So by hormones, we mean that if the body's normal hormone fluctuation is going abnormal, that can predispose to cancer. So how can it get abnormal? So if a woman is having some exogenous hormones, she's consuming hormones, like there may be women who are postmenopausal, periods band ho gaye hain, their bones are getting weaker, so they are given hormone replacement therapy for overcoming the osteoporosis, can get higher risk of breast cancer. Then there may be women who have consumed the oral contraceptives of the previous generation. There were some steroidal ones which were used in 70s and 80s. Using them for more than 15 years also predisposed to breast cancer. Then nowadays, we see a lot of people are encompassing infertilities, and for infertilities, they are going for multiple sessions of IVFs. That again is leading to addition of hormones in your body exogenously. So these may be predisposing. The other hormonal impact is that if your periods are going for a long duration, you're starting your periods at a very young age and they are going on till a very late age. So the monthly fluctuation in the body, the hormonal fluctuations are going for a long duration of time, that also predisposes. One fact which this slide definitely does show, if you pay close attention, that genetic cause of cancer is very less in number. And mostly people are living in this myth that cancers only happen when if somebody has cancer in their family. But it is not true. And you can very well appreciate in this slide that familial cancers are responsible only for 2% of cancers. When we talk of breast cancer, yes, independently for breast cancer, the number may be 8 to 10%. But in general, for overall picture, if you see, genetic causation for cancer is just limited to 2% of cases. Then few cases may be related to occupation. This is not for breast cancer, but people who are exposed to certain chemicals, certain inhalation of asbestos, mining industry, leather industry, they can get certain cancers like bladder cancer, skin cancer. Pollution also The way the pollution is increasing in numbers, with years to come, we are likely to see higher incidence of cancers because of pollution. As of now, one example we all know is of the Bhatinda belt in Punjab, where a lot of chemical fertilizers and other industrial waste went into the waterbed of that particular belt, and we see a very huge number of cancers in that area. So similarly, if such pollutants continue to erode our environment, they get into our food cycle, they're already in the air, can also increase the incidence of cancers. And these primarily would include the cancers of the lungs, the kidneys, wherever these toxins will enter. So it is a very important slide. I think one should definitely try to keep in mind these risk factors. If you are taking into account all this, you can protect yourself from a lot of cancers. So in general, this is the mnemonic which can tell you all the symptoms cancer can cause, which include change in bowel bladder habits, any sore, कोई जख्म भर नहीं रहा है, any bleeding from body, lump or a thickening in breast or elsewhere, indigestion, a change in a wart or a mole, or cough or hoarseness, आवाज में तब्दीली, which is not going for weeks. You are taking medicine, but it is not getting relieved. These are the symptoms. Now, I will particularly talk of breast cancer because I have given you some risk factors in the general risk factor category, but now we'll focus more on the breast cancer because that remains to be the topic of the day. It is the commonest cancer in our women. So these are the four cancers: breast cancer, cervical, lung, and colorectal, which is common in our country, but breast cancer is very common. So the incidence currently worldwide, if you see in the Western world particularly, it is 1 in 8. That means out of the 8 women, any one woman can get breast cancer. In our country, incidence relatively is lower, but you would see some polarization. If you look at metropolitan cities, there the numbers are higher. When you see the rural areas, there the numbers are lower because, as I mentioned, breast cancer is hugely impacted by the lifestyle. The westernized lifestyle or the urbanized lifestyle predisposes you to breast cancer. So if you look at the national figure, it is 1 in 28. But the suburbs, the rural and the metropolitans, they have a separate incidence rate independently. So risk factors, few I have already mentioned briefly. Gender, the female gender predisposes you to have higher risk of breast cancer. Excuse me. So by female gender, as I told you, because the hormonal fluctuations in the female's body are different. So that predisposes them to these cancers. Secondly, the amount of breast tissue in women is more. So that is one of the reasons that you see more breast cancers in women. Men can also get breast cancer. The incidence is 1 in 100. The incidence is very low. That is also related to hormones. And if it happens in men, it is more aggressive because they don't have breast tissue. It starts to grow inside. Second factor is history of breast cancer. So by history, we mean if a lady has a history of breast cancer in her Mausi, Nani, or mother, all the maternal relation, or excuse me, if there is incidence of ovary cancer in her maternal relation, or in mama's side, if there is pancreatic cancer or prostate cancer, there can be incidence of breast cancer. Age more than 50 years, it is a higher risk. Women who consume tobacco, are obese, consume alcohol, again are at high risk. Just give me a moment. I think, sorry. So the sore throat season is on, so you will have to excuse me.
Dr. Kanika, please take your time.
I've just come out for
Take a minute.
So that has just taken up my throat again.
Please take a pause. If anybody has any questions, please feel free to drop it in the chat box. We'll take the questions at the end of the session.
No problem. I think it's better now. Just come out of a URI, so I was anticipating this bout of cough. Anyways, so I'm clearly audible. You can hear me well?
Yes, all good.
Yeah. So then genetic, as I already told you, family history. There are some genes, if you must have heard of BRCA gene, BRCA gene. I think it was a household name when Angelina Jolie revealed that, she has undergone removal of her breast and ovary when her mother and her Mausi as well as her Nani, they succumbed to breast cancer. So she tested herself and she was found to be positive and she had this mutation. So she got this prophylactic surgery done. So if somebody has these mutations, which are not done randomly for everyone, we have to figure out who could harbor that. Then only we conduct these tests. So that can predispose. The other factors is that if a woman has no children, so what is the impact? So if somebody does not have children, she continues to have the menstrual cycles. So in the menstrual cycles, there is a fluctuation of the hormones. So the breast tissue is predisposed to repeated exposure to them. So that, excuse me, just a moment. Sorry. So that again increases the risk. So it is said that if a woman has her first child before 30 years of age, the risk of getting breast cancer is less. Whereas if a woman does not have a first child before 30 years of age, then risk is higher. It does not, it will definitely happen, but the risk increases. Then early onset of cycles and late menopause, because as I mentioned, the hormonal fluctuation body is taking for longer duration than hormonal drugs, as I already mentioned in that pie chart. So how would a woman know that she might be having a breast cancer after understanding that who's predisposed? First and the foremost, the commonest symptom which we see in the women is lump. So lump is any swelling, gaunt, guilty, or it can be in the breast, or it can even be in your armpit. It can be in the armpit, or it can even be behind this collarbone area, particularly the center of the neck, somewhere here. So if somebody feels any nodularity, any lump in these areas, she should definitely show it to a doctor. But at the same time, she should not panic because there are other reasons also. I will talk about them, but it has to be shown. Apart from lump, sometimes there can be discharge from the nipple, particularly if that discharge is blood stained, it is red colored, then it can be cancerous. Although there are a couple of more reasons by which blood can come out, but blood stained discharge is something you cannot ignore. Nipple retraction. So if normally after puberty, your nipple was normal, it was protruding outside, but it starts to go inside. That can again be indicative that something is pulling the nipple from inside. That can be a tumor which is pulling it inside. Or presence of nodules on the skin or ulcers, somewhat like this. I have a picture to represent this. So if somebody has these multiple nodules, not a simple rash, not just a mosquito bite type of a rash, if there are multiple rashes, you're applying medicines, they're still not going, then it has to be shown to a doctor. Sometimes few women may just feel a asymmetry of the breast. That means one breast is at a different level, the other breast is at a different level. But here again, I would reassure you, sometimes there may be slight discrepancy in both the breasts, particularly women who have breastfed. The child, if has fed from one breast more, there may be a difference in size in both the breasts. So don't worry for that. But if the nipples are not at the same level, but they were previously at the same level, then that is something worrisome. So how would you know that? I will just briefly tell you how to do self breast examination in few of the slides, or maybe I'll just talk it down to you how you can conduct it. That is how you can identify. So these are the things which you should take notice of. And apart from this, if you are having weight loss for which you are not finding any cause, unintentional weight loss is happening, you're having some body aches or some cough, which can happen when you have ignored the breast lumps and the tumors have gone and beyond to other parts of the body. So this is what I was reassuring you in between also, that if you do find a lump, don't panic, because many women can have many other lumps. So when a woman is growing through her adolescent to the menopause age, because of some hormonal fluctuations, sometimes some breast tissues get more dense. We call it fibroadenosis. In that situation, women will also say that I get pain in my breast, particularly just before the periods are about to start. So that is not a worrisome situation. Many a times there are some fibroadenomas, just like uterus has fibroids, Breast can also have fibroids. So they can also appear as lump. But you cannot self-diagnose. A doctor can feel and differentiate between these lumps vis-a-vis a lump which can be cancerous. So all lumps are not cancerous. Similarly, all cancers may not show up as lumps. As I told you, there can be just a swelling in the neck or the armpit, and breast may not show anything. So both ways you have to be cautious, but at the same time not panic. So what else we can do? So these are the symptoms. So if you don't have symptoms, so what additionally you should be doing so that you can prevent or you can pick it up early. So the best way of cancer prevention or early cancer detection is screening. Screening means that you are trying to do some tests or examination on a person who does not have any problem. A very simple example I'll give you. When you travel by air, when you are going through your security check-in, they screen your bags. So what they do is your bag goes through an X-ray and they can see what is hidden inside. So screening in medical science is also similar. So since you don't know what is inside, we are conducting certain tests to see what is hidden. So what can be hidden? If you just talk of in a general screening, not talking of cancer, there may be unknown diabetes. You can have hypothyroidism, which you are not aware of. There may be blood pressure, or there can be anemia, which nobody knew about. So sometimes if you are, of an average or a high risk for cancer, there may be hidden cancer. So that is why it is important that every person, I'm not just talking of women, every person should at least once in a year go for an annual health checkup, which encompasses the commonly prevalent diseases of that area. And based on your age, gender, and your risk, some screening for cancers should also take place. So this cancer screening should be done for breast cancer, which would include a physical examination. The doctor who would examine and check the breast and see if there is any lump, may conduct some lab test if she finds something significant, which could include some FNAC, or if she finds that you have a very strong family history, then she might recommend you to meet a genetic counselor who can find whether there is a chance of finding BRCA gene in your family, and that should be tested or not, because genetic testing is not done for everyone. As I told you, genetic cancers are very less in number, and genetic testing cannot be done just like any simple test, because you need to understand the implications, what would be the options in case it comes positive. So genetic test is not a part of screening, it is a recommendation if the doctor finds something in the family history. So for breast screening, age is ideally 45 years. If there is somebody in the family where you found that breast cancer happened in 40 years of age, then you don't wait for 45 years. Then you start screening at 35 years. That is 5 years prior to the youngest member in the family who got cancer. So screening mammography, ideally for an average risk where there is no family history at 45. Others should start screening early, though it will not be mammography. It might be done with an MRI or an ultrasound of the breast, because before 40 years of age, mammography is not recommended because it does not give any information. We cannot see much in the mammography if we do it in young women. The breast tissue is very dense, so we cannot see those small tumors which might be hidden inside the breast tissue. There we prefer to do some other tests like ultrasounds and MRI. But take home for you is after 45, every woman should go for a mammography, and till when? At least 54 years of age. So this is the guideline which I have highlighted here. So the mammography, the new guidelines say every year from 45 to 54 years of age should be undertaken. If they are normal, you did not find any findings in that. By normal, we mean you will find a score, BI-RAD 1, 2, up to 2, nothing to be done, just repeat it every year. If there is a BI-RADS 3, then the doctor might want to see you in 6 months, because BI-RADS 3, the incidence or the risk of cancer is around up to 5%. So there might be some findings in that mammography which warrants that the test should be conducted after 6 months. If it is a BI-RADS 4, then of course, unfortunately, it turns to be a cancer. Then accordingly, the treatment is done. After 54 years, the mammography can be reduced to once in every 2 years. And it should be done till the age where you feel that there is at least 10 years of more life. So although nobody can predict that, but on average, we do say that up to at least 70 years of age, one should continue to go for the mammography. After that, it is a case-to-case basis. If there is a family history, or it can be done need to do basis as well. So that is how it is to be done. Clinical breast examination is to be done every year. So once you go for the annual checkups, you should go for the clinical breast examination. And clinical breast examination can be started as early as 20 years of age, because as I told you in the beginning that nowadays we have seen patients as early as 18 years as well. So you should start the annual screening at 20 years. Sorry. Then there is something which this guideline does not advocate. We call it self-breast examination. Why this guideline does not advocate? Because it's a US guideline. It's the ASCO guideline. And in US, everybody goes for mammography. So we are not missing out. Whereas in our country, despite whatever we might try to do, we would not be able to offer mammography to the last standing woman. So there we still insist that every woman should find time once in a month for herself where she can examine her own. So what do we intend to see in the breast examination? So the woman should maybe while bathing uncover herself till the waist level, and in front of the mirror you should see both the breasts. As I said, both nipples should be at the same level. Both breasts should, if they have been of the same size, should remain to be of the same size. If you have not breastfed, or uh, there is no discrepancy since childhood, the nipples should be projecting out if they were always projecting out. If there is a change in the nipple, then of course we need to notice that and bring it to the attention to a doctor. Second thing you need to do is, after seeing the breast architecture, you need to keep both your arms above your head. So when you both your arms above your head, then you can appreciate the under surface of the breast. Then you can see if there is something below the breast fold, that will become more appreciable. Third thing which you need to do is that you put both your hands along your waist and droop forward. So normally both breasts should droop forward same. If one breast is hanging and one is just sticking to the chest, then there is something of concern which needs to be shown. And after that, with the flat of your hand, with the flat of the hand, you should press the entire breast in a circular motion, or from up to down, from the collarbone to the tummy, to check whether there is some lump or some swelling. If you do this once in a month, around 6 to 7 days after your periods have commenced, you will be able to pick up any abnormality very early. And for women who do not have periods, or whose periods have stopped, they should pick up any one Sunday for themselves and regularly conduct this self-breast examination. If you have doubts, you will find ample, information on Google. Even I have a channel, Health Talks by Dr. Kanika, where I have briefly talked about self-breast examination in one of the talks. So you can refer to it, or maybe you can separately send in a query if you have query pertaining to it. So this I've already told you how it is to be done. Apart from all this, I think keep these 7 tips in mind. Do not smoke. If you are a smoker, you are predisposing yourself to a lot of health problems every day. In our country, we lose 2,500 people because of smoking. It may not be cancer in all of them. It could be heart diseases as well as lung diseases. And why I'm saying that, because we are seeing that there is a trend of smoking in women also. It is not that women don't smoke. Even the youngsters you see in the malls, in shopping arcades, that in the smoking zones, you'll find a lot of young girls. So do not predispose yourself to these health issues. Try not to smoke. And once you stop smoking, to reach a non-smoker level, it will take you 10 years. So the earlier you stop, the better. Maintain a healthy body weight. So healthy body weight means that your body mass index, if you can calculate on your phone, it should fall between 18 to better 21. Because after 21, we say you are overweight. If your body mass index comes above 25, then you're obese. So try to maintain it between 18 to 21. And for that, you should eat a lot of fruits and vegetables. You should avoid processed food. As I said, the processed sugar, maida, these are the ones which tend to make you obese from the tummy, and which predisposes to hypothyroidism, diabetes, as well as certain cancers. Be active and join some form of exercise. At least 180 minutes of exercise in a week should be encouraged. which can be any form of exercise. It is not that you all have to just go to the gyms. You can do yoga, you can do stretching exercises, you can do walk, but involve yourself in some form of physical activity that will reduce your risks of dying from lifestyle diseases by one or almost 40%. And that is what the WHO says, that if you are conducting 180 minutes of exercise in a week, your risk of dying with lifestyle diseases, which I've enumerated, is substantially lower than the people who don't exercise. Limit alcohol, because as I told you, tobacco, alcohol, they act in synergy. Alcohol independently also is responsible for causing breast cancer. Protect yourself from sun. This is not for breast cancer, but for skin cancers. You should use some sun protection when you walk out of the house in harsh sunlight. And follow the screening recommendation, the one which I told you about, the mammography. Though we're talking of breast cancer, I'll take a moment that screening should also be done for cervical cancer, because that is the second most common cancer in Indian women, which includes a test which we call as a pap smear. So pap smear is a test which should be done for all sexually active women at least 3 years after sexual activity has commenced, and it should be conducted every 3 years till 65 years of age. If you can get vaccinated, try to get vaccinated if you are less than 45 years age for human papilloma virus, because HPV is the virus which is responsible for cervical cancer. And if your daughters in the house who are less than 15 years of age, it is better that you get them vaccinated well in time, because efficacy of vaccines is best when children are young. As you grow older, the efficacy goes down. And if all this is done, at least we can ensure, as I said, Lancet said, 63% of cancers in women can be avoided. So I think all it needs is more attention to your physical health and following certain norms. And this, whatever I said, is nothing which is very difficult, because this was a lifestyle which Indians followed. If you look at the traditional Indian thali, the food which was there in our traditional Indian thali always had curd, always had vegetables. It had perfect portion of all the food items one should be eating. So try to eat more traditional. Surely, we are living in a world you can't avoid, but if you have to eat processed food, please do that in moderation. So I think that is it from my side. And do not think I'm immune to cancer. It can happen to anybody. Don't run away or don't fear if it does happen to anybody. And it's not an incurable disease. As I told you, science, technology, our armamentarium is getting better. We are able to give better cure rates in the current era. Just it is that you have to be cautious, better not get the disease. If it is preventable, you should make all the efforts to ensure that at least you or your loved ones do not fall trap to this disease. So I'll stop sharing, and now I would love to take any questions or queries if you have. So over to you, Sujita, if there are some questions.
Sure. Thank you so much, Dr. Kanika. Honestly, we at Futurisk always are delighted to have you on our health talk sessions. Thank you for sharing such a beautifully put together presentation. I personally loved how so many illustrations and data simplified the insights. And on behalf of Futurisk and all participants, I would like to extend our gratitude to you. And if anybody has any questions, please do not hesitate. Please put it up on the chat, or you can unmute and speak. Doctor, we have a question from Priyanka Prasad. She is asking, what is the difference between mammogram and ultrasound?
Okay. So mammogram is an X-ray. So what we do is, in a mammography, there is a plate on which the breast tissue is placed, and we press it with another plate to flatten it. And what we are trying to look for is some calcifications. If there are some calcifications, we categorize them, whether they are irregular or they are filigree. So based on that architecture, a doctor can give a score, and that score can tell us whether there is a risk of cancer or not. Whereas, as I told you, when women are young, we have a lot of glandular breast tissue. It is like ek asman hai, and there are a lot of clouds. So a young woman's breast is having a lot of clouds. So you cannot appreciate these calcifications. There may be calcifications, but they are hidden behind. So it's like you can't see stars when there is a cloudy sky. So in that situation, we prefer ultrasound because ultrasound is not looking for calcification. Ultrasound is looking for proper lumps, growths, cysts. So that is why we prefer to do ultrasounds in younger women, but it is not a replacement for mammography. Most of the times, it just gives you a cue that there are some cysts or there are some solid masses. When we are doing mammography also, sometimes we would require some ultrasonic information added to the mammogram. So many a time you will see that you go for a mammography and after mammography an ultrasound is recommended because doctor wants information from both aspects. They want to know the architecture as well as the cyst. So they are not replacement to each other. It's just that for younger women we can't do mammography, so we reserve ultrasound. But most of the times ultrasound is a problem solving tool along with a mammography. So that is the difference. And nowadays, mammography also, if you see, there are a lot of different types of mammography. So the digital ones are said to have a better precision in picking up cancers. Ultrasound, the advantage which I would say is that you can repeat it as many as time as you want because it does not give any exposure to your body. So if a woman has lumps in her breast which are fibroids, then we would follow her up on ultrasound rather than a mammography. So that is how both these modalities differ in terms of the information they give us.
Thank you so much, doctor, for answering the query. If anybody has any other questions, please put it on the chat board. There's another. Are factors like hypothyroidism in a 55-plus-year-old woman also counted as risk factors in breast cancer?
So hyper fortunately does not. Hyperthyroidism does not predispose to breast cancer risk. Hypothyroidism, if you talk, hypothyroidism predisposes to uterus cancers. So there are cancers of the endometrium, which are more common in women who are hypothyroid. And along with hypothyroidism, they also have high blood pressure and diabetes. So we give it a name called corpus triad syndrome, that a woman who's slightly obese and has all these three is likely to have endometrial cancer, but not breast cancer. And particularly hyperthyroid definitely does not predispose to breast cancers.
There's one more question, doctor. It's from Priyanka Prasad. She's asking, is there any point in getting HPV vaccine after 45?
So data does not support. The reason is, the purpose of HPV vaccine is to give you an immunity against a virus, which is human papilloma virus. So if a woman is getting done a vaccination done at 45, it does not add to her immunity because she has already received that exposure by sexual contact. So it will not raise immunogenicity. Even if you look at the percentage of benefit, if the efficacy of the vaccine is 97% in a child, it drops down to 77% at the age of 40 years. So beyond 45, it does not add value. It does not add any additional immunity. So that is why the catch-up age has not been recommended beyond 45 by the WHO also.
We have one, doctor. Just 1 second. It has come on YouTube. Miss Pavani Pranav is asking, she is not having an even breast, which was observed after postpartum.
Mm-hmm. She Suchita, you're muted.
Yeah. Just that she wants to know that, she is not having an even breast, which was observed after the postpartum.
So as I said, see, after postpartum, you might find difference in the breast because people who have nursed children would know that sometimes child, nurses or lactates from one breast more than the other. So the breast from which the breastfeeding has been done more sometimes is slightly bigger in size as compared to the other one. So many a times you might find lumpiness, tenderness, closeness, or unevenness in the breast after postpartum. But one thing needs to be understood, that if that unevenness continues to be there, or you find some hardness which is out of proportion, then you should definitely show to the doctor. See, two reasons. We are not always thinking of cancers. Sometimes the breast milk may get collected in some part of the breast, which can form an abscess. It may get collected, and sometimes it becomes so worse that you have to give a incision. उसको काटना पड़ता है, चीरा देना पड़ता है. So that is why, if there is something which is out of proportion hard and it's paining also, it's hurting also, then surely you should show to the doctor. It may be a galactosile. The blood, the milk might be collecting somewhere. So here I'll again mention one thing. I think I missed out on saying that in the presentation, that pain very late happens in cancer. People always feel that I have a lump, it is not paining. So pain is always last to come. Most cancers are painless to start with. It is just when it starts to erode adjacent organs that it causes pain. So don't ignore painless lumps also.
Doctor, we have one more question. It's from Jacinta Ravi. She's asking if clinical hypothyroidism is not treated with thyroid medication, would it pose a risk? Please consider factors like irregular period, but healthy body weight.
So yes, of course, if you're not treating, if it is a clinical hypothyroidism and you're not treating, it does pose risk. So what does hypothyroid? It is a metabolic defect. So when hypothyroidism is not being corrected, it is also affecting your insulin pathway. It is predisposing you to becoming, abdominal weight starts to this fat starts to increase, and then in the abdominal fat there is exogenous or extra hormone formation. So if the tummy fat is more, even if your overall body weight is fine, if your tummy fat is more, in that fat, estrogens and progesterones are formed, which again predispose to cancer. So hypothyroidism should not be left uncorrected, because it not only affects, it is not always about weight, it also affects your cholesterol metabolism. So people who are hypothyroid, you will see they will have fatty liver also. They will also have higher cholesterol levels. So I think if somebody has significant hypothyroidism, they should get it corrected. And women particularly, see, hypothyroidism also causes infertility. So if a woman is planning for a baby, it is said that TSH levels should be less than 2.5. So particularly the childbearing age, hypothyroidism, I think, should be in discussion with the endocrinologist, of course, treated well in time. If childbearing is not thought of, sometimes we can leave it uncorrected up to the value of around 7.5 to 8, but that again is case to case basis. So ideally, one should not leave hypothyroidism untreated, not only just because of cancer, but because of the other metabolic side effects it causes onto the body.
Thank you, doctor. We have one more question. It's from Ms. Priyanka Prasad. She's asking, is polycystic ovary connected to cancer?
So there is no direct correlation. Polycystic ovaries do not, they are not precancerous for sure. But obesity and hormonal imbalances per se may predispose to breast cancer, but it is not the PCOD which has a direct correlation. So PCOD has so far not been a screening trigger. It is not that somebody who has polycystic ovary that will conduct CA-125 or the tests in her. It is not directly correlating.
Thank you, doctor. That's, I think, the end of Q&A. If anybody else has any questions, please do not hesitate. Please type it or unmute yourself and speak. We can give you another set of minutes.